This is One on One. We're now joined by Dr. Liana Spano, who is a cardiologist with the Summit Medical Group. How are you doing?
I'm doing well, thank you.
The field of cardiology changed dramatically in the last 10 years.
Absolutely.
How so?
Yeah. Well, I think that cardiology in general has one of the quickest paces when it comes to changing and knowledge and information. Cardiology is a field that provides a lot of scientific data. There's a lot of clinical trials that go through cardiology, and we've learned a lot about cholesterol and lipids in the last 10 years. Statins have been developed in the last 10, 15 years. Stents over the last 20, 30 years. So it's just really quickly changing, and there's a lot to offer in cardiology now that there wasn't many years ago.
But still, heart disease, the #1 killer of women.
Yes. Yes.
Always the case, or more recent, or what?
Always the case. What happens is, so heart disease is the #1 killer in general. So of all comers, men, women, black, white, Hispanic. People don't realize that heart disease is such is such a large amount of people that are affected, and it is the #1 cause of death in this country.
The #1 cause of death across the board, men and women.
Men, women, all races.
So let me play devil's advocate here. I was just saying to you that in our family there's a history.
Yeah.
Right. My grandfather, whom I never knew, passed at a very young age, at the age of 44. My father's brother passed at a very young age. Mm-hmm. My dad's had issues. But I've always said to myself, because I exercise, because I don't smoke, blah, 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 I've convinced myself
that you're safe.
Yes.
Yeah. So unfortunately,
tell me
I wish I could say that was always the truth. And in general, we like to, regardless of your risk factors, we always strive to achieve healthy lifestyle and do all the right things, because you'd be much worse off if you didn't. But there are some people who are at higher risk than others, and there's primary prevention is the key. So what it comes down to is preventing disease before you become affected, and that's called primary prevention. So I try to see most of my patients before there's an event. Unfortunately, we meet a lot of people after they've been sent to the cardiologist because they've had an event.
So they won't go, many won't go until something has happened.
Many, yes.
But the smarter thing to do is to get ahead of it.
Right, either an internist or your family doctor or a cardiologist, so that you know what your risk factors are, and risk factors that you wouldn't even have known before. So when I talk to patients, I discuss modifiable and non-modifiable risk factors. Modifiable being the things you can change. So you can't change your age, you can't change your sex, you can't change your postmenopausal, premenopausal status. Family history, it is what it is, you got your genes. The things you can change: controlling diabetes or avoiding diabetes. Smoking, #1 preventable risk factor.
Number one?
Absolutely. Smoking is a huge risk factor. High blood pressure, controlling high blood pressure. Weight loss, maintaining a healthy weight, exercising more than 30 minutes a day most days of the week. Consuming a heart-healthy diet. So diet high in fruits, vegetables, phytonutrients, healthy fats, omega-3s, and things like that. So those are the risk factors that you need to try to avoid or try to promote to avoid heart disease.
Doctor, when you see a patient that is very heavy and either bordering on obese or obese, how direct are you? Because I'm a student of communication. I'm fascinated by how candid people are or are not in their communication in every field, but particularly in medicine and health. Because I'm like, what are you holding back?
Yeah.
How candid are you with the correlation between that person's weight and the pressure, I believe anecdotally as a layperson, is putting on that person's heart?
I think it's my responsibility to be as candid as possible. It's the office where I'm in a room with a patient is a private interaction between myself and that patient, and it's my responsibility to give that patient the most information. So I am very, very honest with them. And to be honest, it takes it out of my hands, being that the BMI, the body mass index, is a clear-cut number that puts you into a category of overweight, obese.
Explain it to people in simple terms.
Sure. So the body mass index takes your weight and your height, puts it into a calculator and says, your BMI is, say, 30.
Yes.
Anything over 25 is considered overweight. 25 to 30, overweight. Anything over 30 puts you in the obese category, and anything over 40 is morbidly obese. So therefore, it puts it into a calculator, it gives me a diagnosis, and obesity is a diagnosis. So it allows me to be very concrete and very straightforward with this patient and say, listen, you are obese, and we need to work on that. Unfortunately, there's obviously a little bit of an art to the
communication.
Right, exactly, the communication and the giving the information. But it's very important that the patient understands that they're at risk because of that weight. And I work with them to develop a plan on how to reduce the weight, including heart-healthy diet and exercise, and if needed, bariatric surgery.
It's interesting. Family members matter in this too.
Absolutely.
Do you talk to the whole family? Sometimes.
It depends on the person and the issue.
I'm often fascinated by the idea that heart health for women is, I'm not going to say misunderstood, but not talked about a lot. Is that getting better?
It's definitely getting better. Over the last few years, the campaigns that have developed, the Red Dress campaign, the Heart Truth campaign,
right,
they've increased awareness amongst women. But still, I think women are more concerned or scared of breast cancer than they are of their risk of heart disease. And to be honest, heart disease is a much more prevalent disease in women.
So let me ask you, symptoms of a real problem with your heart for a man or a woman, are they different?
They tend to be different. Women tend to have more atypical symptoms. Atypical meaning not the classic crushing chest pain that men typically have. But I've had many men who come with atypical symptoms. Reflux, I think it's indigestion, I'm not entirely sure, take a Tums, it kind of goes away. So they do cross over. But in general, women do get a little bit more atypical, meaning shortness of breath, sometimes a jaw pain or an arm pain, sometimes indigestion or abdominal pain, back pain. So it can vary.
But being aware of those symptoms, being aware of your risk factors, critically important.
Absolutely. So being aware of your risk factors and not ignoring the symptoms.
Don't say, oh, it's probably indigestion.
Yeah. Unfortunately, that's the truth. A lot of us would like to think that we don't have disease, and I would tell you that most people who come into the office with chest pain, it winds up being nothing.
But if not?
But the few people that do have real symptoms, we wind up making a real difference. And so it's really important to not ignore your symptoms.
Dr. Liana Spano,
yes.
Originally from Staten Island, now a cardiologist with the Summit Medical Group. I want to thank you so much for joining us.
Thank you.
Appreciate it. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by
ShopRite Supermarkets,
New Jersey Council of County Colleges, the Give Something Back Foundation, Choose New Jersey, Century 21 Construction, Cone Resnick,
and by the New Jersey Office of the Insurance Fraud Prosecutor.
Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.